So here is how you would navigate that from an imaging point of view. So if you have that young patient that you suspect is in the process of developing a pars defect, then the most sensitive and specific imaging tool at your disposal is the MRI. Now, radiography can be helpful, but only once the defect has happened. And radiography can really only see it if there's been a spondylolisthesis associated with it as well. So now we got that gap, which we can see a little more visibly. So in that setting, there are a couple things that might change our approach to imaging. So for example, well, let's just reiterate again. If you want to find a spondylolysis before it happens, MR is your go-to test. And it has to you have to have what we call fluid weighted sequences, and especially fat suppressed. And so most MR imaging centers, when you order a lumbar spine, they often include what we call a STIR pulse sequence, short tau inversion recovery, in the sagittal plane. And that's usually adequate to find that marrow edema. Now let's assume that you're palpating and you feel that step-off defect that we often feel as we're palpating. That spinous feels a little more prominent. It's tender. That usually implies that the defect has happened and there's been a slip, or the spondylolisthesis. So that's where radiography can come into play. Radiography has a decent specificity, but again, the sensitivity is limited. So unless there's a significant slip, sometimes these are hard to see, even if you get oblique views of the lumbar spine. If there's not a lot of displacement at the defect site, then sometimes it's really challenging to see because of all the overlapping anatomy.